G'day everybody, Chris from the Headache and Pain Management sitting here for your Wednesday. It's day 3 of National Pain Week, and today I'm answering a question that we get a lot here at the clinic. And that question is, should I exercise even though it hurts? It's a really good question. I'll answer that for you today. And if it is applicable to you, how much should you do? So we'll go through that as well. If you are joining me, type in below, say hello. It is Wednesday of National Pain Week, and if you stick around, I'll be telling you something that is really going to excite you about tomorrow. Deborah's just coming in to grab her stuff. G'day, Deborah. Hello. So yes, that's how we're all going from there. So when we've got pain with exercise, so it's really important for people with pain to exercise. Okay, so when you have pain, it can actually be a little bit of a yellow flag, a little bit of a risk factor to exercise, and that's really important if you've got an acute injury with actual tissue damage. So if you've actually sprained an ankle, if you've strained a muscle, things of that nature, then it's important to do as much activity as you can without actually injuring it. So for the first 48 hours, 72 hours, sometimes it is best actually just to stay off it, just to let things settle down and then get back to it. But when it comes to chronic pain, the mistake that often people make is they equate pain with tissue damage. So what happens is that they stop exercising, they stop doing movement altogether because it hurts. And of course, if you don't know how your pain works, then obviously you're going to go, well, I'm not going to move because what if I make things worse by doing it? And this is especially relevant for people who are trying to exercise and they're getting a lot worse after they exercise, so they quite often give up. And it's not really, it's not really useful, and they just sit there and put on weight, and they just get sicker and in more pain. So what to do about it is probably the good question. So the first thing to do is that you should take an attitude that exercise is good for you no matter what. Okay, so regardless of what it is that you're suffering with or suffering through. G'day, good to see you there, thanks for the like. When you've got chronic pain, it doesn't matter what type it is, it doesn't matter what sort of health condition it is, exercise has been proven time and again to be more effective than any other treatment to get things better. So for depression, anxiety, for pain, exercise is king. No medication can come close when it comes to the research into it and the results that you get from exercise. So I guess the question is, how much should you do, and what is dangerous and what is safe? The first thing to know is to actually know what your diagnosis is, so what's actually going on. So if there is something extraordinarily dangerous, okay, so if you've got something very rare that is impinging a spinal cord, or something that's really drastically, so it's taking out both legs, or things of that nature, then obviously you need to check with your doctor, spina bifida, things of that nature. We want to make sure that it's safe to move, it's safe to exercise. If it is safe to exercise, so your heart's good, your lungs good, there's nothing there that is stopping you from exercising, then exercise is very good to do. And then it's finding what you can actually do. So the best exercise for those playing at home is the exercise that you enjoy. That's the first one, and it's the exercise that you can do. So that you've got the environment to actually do. So there's no point actually saying, yes, I'm going to do all of these great exercises, but you've got no space to do it. Sometimes actually just going for a walk is the best thing to do. So whatever exercise floats your boat, whether it be a gentle walk for 20-30 minutes, if it's a little bit more strenuous than that, even if it's a little bit of just getting up and sitting down from the chair 10 times to start with, doing something like that is going to get the ball rolling. And the more that you do, the more that you will be able to do. So people that you look at on TV, Michelle Bridges, athletes, things of that nature that, they're fitness gurus. I'm watching Australian Ninja Warrior at the moment, so watching these guys, I'm in awe of them, by the way. They actually train their bodies to get to that point. But you always see on shows like Ninja Warrior and The Biggest Loser, things of that nature, that they do start at a point which can often be really bad, okay, where they can't walk, or they've had a very severe illness, they've had cancer, they've had chronic fatigue syndrome or fibromyalgia. The old Chinese saying is that the longest journey begins with the first step. So if you do have chronic pain, if you are really struggling, then actually getting the mindset to start is quite often the thing that restricts you the most. So actually getting started, doing something small, even if it's just walking for 5 minutes or 2 minutes even, if things are really bad, can be the place to start. And then when you start, you do more, you train your body, you train your brain, you train your nervous system to get fitter, more active and better. And when it comes to pain, the more movement that you do, if you're doing it in the way that is not painful, that's taking it to the point of first discomfort, but it's not blowing it out of the water either when you're doing it or afterwards, you take it to the first point of discomfort, generally things are okay. If you can't do things to the point of first discomfort without actually blowing things up and making things a lot worse, then it's actually worth talking to someone who specialises or is expert in talking about pain. So that's the sort of patients that we see here a lot, where patients actually cannot exercise, they don't know what it is they can do, and we actually need to diagnose and treat the reasons why the pain is there. Okay, so as I've mentioned in my previous videos, quite often it's the way the brain is receiving the signals from the body and receiving things from the senses that's causing the pain to happen. So we need to retrain that first before we get to actually moving. So at times, it's actually imagining movement first rather than moving on its own. In summary, exercise and movement is absolutely the best thing for chronic pain. Motion is lotion. Even if it's really hard, even if it is a little bit painful while you're doing things, and sometimes even if it's a lot painful while you're doing things, it is good for you. So it's really good to talk to your physiotherapist, talk to your exercise physiologist, talk to your doctor about what the options are for you, because exercise is king when it comes to treating all sorts of things. Chronic pain, depression, anxiety, and all the different myriad other things that can come with suffering with chronic pain. I hope that's been helpful for today. There's another video coming tomorrow for National Pain Week, so I can't wait to tell you all about that. And as I said, there is something coming tomorrow on Facebook, something very special for everyone out there, for all our followers for National Pain Week. So if you are looking at this video and you are excited about that, type in below excited, and I might even give you the special thing over your private message before everybody else gets it. So type it in underneath excited and I'll send that across to you, because it is very exciting. I've never done anything like it before and I'm releasing it tomorrow, so I look forward to doing that for you. Hope you have a really good night, good afternoon, and we'll see you tomorrow for day 4 of National Pain Week. Cheers and bye for now.